Okay, 12 o'clock, here we go. Thank you everybody for joining us today for the Ohana Center for Excellence webinar on community-based advocacy strategies. I'm Ni Zhang, the evaluator for the Ohana Center for Excellence. I have the honor today to introduce our speaker, Vaughn Villaverde. With over a decade of experience in health policy and federal, state, and local safety net programs, Vaughn joined the Asian American Community Involvement, also known as AACI team, in 2021 as the Director of Advocacy, where he is responsible for leading efforts to engage with elected officials and policymakers in support AACI's various health, behavioral health, and wellness programs. So Vaughn is also responsible for working with the regional coalitions, organizational partners, and members of the community on efforts related to healthcare delivery, health equity, racial equity, social justice, and civic engagement. Prior to joining AACI, Vaughn served as the Associate Director of Health Policy at Working Partnerships USA and worked in the Government Affairs Department at the California Primary Care Association, California's statewide association of community health centers. Okay, so without further ado, let's welcome Vaughn. Thank you, everybody.
Thank you so much, Ni. That was a very nice introduction. I appreciate it. Good afternoon, everyone. Like Ni said, my name is Vaughn Villaverde. I'm Director of Advocacy at AACI, and I'm here to do a short presentation on community-based advocacy models, just to provide folks with a little bit of context as to where this training came from. We have been very involved in our regional response to the rise of anti-Asian hate in the Bay Area, in the South Bay. And so we partnered with Asian Americans Advancing Justice Coalition and Kaiser Permanente to do a series of bystander intervention trainings to just educate folks on what they can and should do should they witness a hate incident in the community. However, after about a year of doing that, this was about in 2021, we saw that attendance to those kinds of trainings, the bystander intervention and the Know Your Rights trainings, really dropped. And so we didn't get a lot of folks wanting to attend those trainings. And then when we spoke with the community and asked them what they needed, they said that, a lot of folks had already received the bystander intervention training, and they wanted something that's kind of like, what's the next step after that, right? Now that we're educated and trained about the individual response to anti-Asian hate, folks in the community really expressed the desire to kind of take that up one level and work on this issue at a systems, at a policy level. And so we developed this training to help folks kind of wrap their heads around what is advocacy and how does a community, how do individual community members go about engaging in effective and sustainable policy advocacy. So just a little bit of background. I come from an organization called Asian Americans for Community Involvement, also known as AACI. We are a nonprofit federally qualified health center based in San Jose, and we provide health, behavioral health, and wellness services in the community. We were founded in 1973 in response to the influx of refugees coming in from Southeast Asia during the Vietnam War. And so our core is really working with immigrant communities, refugee communities, communities of color, and low-income communities to try to get them primary care, behavioral health services, and to try to connect them with any resources that they might need. So as you can see from this slide, we provide services in over 40 languages. Our federally qualified health center provides primary care regardless of immigration status and ability to pay. And our behavioral health department provides services across the lifespan. And we also provide services to specialty populations like refugees, asylees, survivors of human trafficking and domestic violence, youth, folks with HIV. And then our wellness programs support our clients in the community. We run a confidential domestic violence shelter, and we also have a number of other programs in the community. So today I was hoping that we can get through a few kind of big ideas. So number one, I just wanted to make sure that we all had a shared vocabulary because there are a lot of, in advocacy, there are a lot of words that get thrown around and they may not mean the same thing for everybody. So words like what is advocacy, what is power, what is strategy, what are tactics. So I'm hoping to go over that. I'm also hoping to take you all on a step-by-step guide on how to engage in effective policy advocacy. And then I wanted to demonstrate a really useful tool that we use in the policy advocacy space for really mapping out complex or complicated advocacy campaigns. There are a lot of moving parts when you're advocating for something. And so power mapping really helps us organize our thoughts and kind of guide our game plan moving forward. Now, as a federally qualified health center, AACI has been asked, why does AACI even do advocacy, right? You're a health center, you provide medical services. Why are you in the business of advocacy? Well, number one, service providers should be at the table when crafting health policy, right? So politicians, policymakers, elected officials, they make decisions about people's healthcare all the time, and not all of them, most of them don't really have any medical expertise on the subject. So that's where we come in. We're able to provide expertise about the patients that we're working with and make sure that what is done is evidence-based. Number two, we also serve specialty populations with unique needs that may be overlooked as policymakers are developing policy mainly targeted at the general public. So we're here to kind of highlight, oh, if you do this, it may help the general public, but it could harm this specific population, whether that's immigrants, refugees, survivors of domestic violence or human trafficking. Those are the kinds of special populations we're talking about. And then finally, the pandemic really taught us that policy decisions on any number of issues really do have a huge impact on health. And so because of that, AACI should be at the table when we're talking about issues like housing. Housing has a huge impact on healthcare outcomes, job quality, quality of education, land use, climate change. All of these things have huge potential impacts on health. And it's another reason why AACI engages in advocacy. All right, so just a few kind of terms just so to make sure we have the same vocabulary. Power, it's a really amorphous kind of concept, but essentially in the advocacy world, power is just the ability to get someone to do something you want them to do. A lot of times, particularly with folks in the nonprofit community service world, see power as kind of a negative, right? It's power could lead to corruption. Power can, leave a lot of communities behind. But I would actually encourage folks in this webinar and, in every situation to simply think of power as a tool. I like to say that power doesn't necessarily change who you are, it just magnifies it. So if you or your organization is doing good work and you build some power around that, you have the potential to do great work. On the flip side of that, if folks who want to harm communities is given power, then there's the potential for that being very, very bad for the community. So just something to think about. And advocacy within this context is just the exercise of power. How do I get someone to do something that I want them to do? After that, strategy. Strategy is an overarching concept, right? So it's in creating kind of a game plan, strategy is kind of your big idea. Like, how do we accomplish the thing that we're trying to accomplish? How do we make the impact that we want to see? Meanwhile, tactics are the steps that you take in order to accomplish your strategy. So just thinking about an example of this, let's say the impact we want to make is that we want to eliminate all red cars in the community, right? We don't like red cars at all. We want to get rid of them. A strategy for getting rid of red cars, one could be passing a law that bans or makes it illegal for anyone to own a red car. That's one strategy. Another strategy could be tax policy. We can raise the taxes for people who own red cars so that it makes it prohibitively expensive to own a red car. And then another strategy could be that we employ, a public shaming campaign. We take out ads and run, Facebook ads, TV ads, saying that, all people who drive red cars are bad. And so we could shame the public into getting rid of red cars. So these are all examples of strategies. And so zooming in on the passing a law strategy, the tactics for that could be like, a tactic could be working with various elected officials, like let's say the city of San Jose, the city of San Francisco, or even the state of California. We could work with lawmakers to pass that law. Another tactic to passing a law would be, for example, introducing a ballot measure. So if we don't want, if we don't think we can get something passed through a legislature or city council or something like that, then we take it to the ballot box. We introduce a ballot measure that would ban red cars. So I hope this kind of illustrates the difference between strategy and tactics. The Q&A feature, I forgot to mention, I'm sorry, the Q&A feature is open, so please feel free to drop any questions or raise your hand. Marie will be providing a little bit, some back-end support, and I really appreciate it, Marie, if you could flag any questions that pop up. All right, so jumping in, advocacy can be very, very scary, and it can be very intimidating. You're dealing with elected officials, you're dealing with potentially powerful groups with a lot of lobbying money. But my hope today is to give, to kind of make the process of advocating a lot more digestible by breaking it down into individual steps. So this might sound very, very obvious, but step 0 when it comes to advocacy is just figuring out what it is you want to advocate for. As I previously said, advocacy can be scary, but it can be most powerful when it's focused and disciplined. And an example of that is if you were to approach a city council and say, I want the city council to do something about homelessness. Chances are all of the members of the city council will say, yes, we absolutely support you. Great. Does that necessarily accomplish anything? No, right? Because what you're asking for is not specific. And so it's easy to say yes to because they're not actually committing to anything. Another kind of, I think, misconception about advocacy is that folks tend to think that it's always adversarial in that, you're always fighting, you're always arguing. And in my experience, that's simply not the case. A lot of advocacy really does mean sitting down at a table with either an elected official or their staff and just, coming up with a strategy to address an issue. A lot of times elected officials will lean on the expertise of various community organizations when they want to do something about a particular social issue. And so that's an opportunity to advocate on how to address an issue, in a way that you and your organization see as the best route forward. The last thing I do want to make sure folks take to heart is that advocacy can be really time consuming and it can really, really take up a lot of your energy. And so the purpose of this training, I hope, is to break down, again, advocacy into those smaller, more digestible steps, but to make it sustainable so that you can do this in the long run. You don't really want to kind of pour 100% of your energy, your resources, your time, and your staffing on a single campaign, because it's probably not the last time you want to weigh in on an issue. And so we want to make sure that when we're doing advocacy that we don't burn out too quickly. Again, we want to focus on generating the maximum impact using minimal resources. All right, with those things in mind, step 1 is do your homework. So once you've identified the issue that you want to advocate for, then it's time to do your homework. So it's when we look into questions like, what is the jurisdiction's history on dealing with this issue? If we're dealing, for example, with, I don't know, the city of San Francisco, and we're talking about mental health. What is San Francisco's history on dealing with mental health at a policy level? Is there anyone in that kind of ecosystem, in that environment, working on mental health issues and advocating specifically for mental health issues? Are they on your side, or are they in the opposition? Where do they stand on the issue? And how long have they been working on this issue? Things like those are important questions. And then if we're dealing with the San Francisco Board of Supervisors, have the individual folks in the Board of Supervisors taken a position on this issue? What's their what's their personal history with this issue? Is it something that they're passionate about? Is this something that they're ideologically opposed to? Is this something that they simply haven't really engaged with and they need to be educated on it? And then lastly, have other jurisdictions, other places address the same issue? What did they do? What was their strategy to address the situation? And more importantly, did that strategy work? Did it not work? If it did work, then it might be something you could consider adopting for our advocacy efforts in San Francisco. And if it didn't work, what did folks learn from it, not from that program or that particular action initiative? What did we learn from it not working? Hope that's clear. All right, now, after that, step 2 is really about finding your team, finding your squad, right? Like I said before, it's very, very easy to spend all of your resources, all of your time, and all of your energy on an advocacy campaign. And the best way to prevent burnout is essentially to share the load with other community members, other organizations that are interested in working on the same issue, right? So ask yourself, are there others, organizations, or individuals on your side of the debate working on this same issue? If the answer is yes, great, ask to join that group. But I do want to caution folks that you want to approach with humility, right? You're not kind of swooping in on this community that's already doing this work. You're not there to save the day. You're not there to be their savior. What you're there to do is to learn what they've done so far, learn what they're doing now, and then lend your expertise, lend your resources, and lend your energy to that group. Essentially help share the load. If in your search for community partners or organizational partners, you are not able to find anyone working on the specific issue that you're advocating for, then reach out to others with whom you share, principles, values, and ask them if they'd like to work on you. Basically, create your own coalition if none exists. And I can't stress enough the importance of coalition building for community-based advocacy. Other kind of advocates, for example, in the private sector and the corporate world, they rely on having a lot of money and hiring professional lobbyists. But for us in the community, that's probably not an option. And so if you work in a nonprofit, if you are just a member of a community or a group of folks, then the only way to kind of make up for that lack of professional lobbying capacity is to build your numbers and build strength by building coalitions. All right, so that's step 2, is finding your squad. Now, this might be the most important step in kind of developing your advocacy strategy. I like to ask myself, anytime I'm starting a campaign, I ask myself 3 questions. Number 1, what is my intended impact? I like to ask this question first because it really sets kind of like your North Star for the campaign. I've seen a number of times folks who have advocated for something and it's taken months and months, but by the end of it, they take a look back and they realize, oh, we're not actually addressing the original issue that we wanted to address, or, oh, we're not at this, what came out of this advocacy process doesn't look like it's going to make the impact we wanted it to make when we originally kind of started this campaign. So again, you want to ask yourself this question first, because it is your North Star, your guiding, what guides you moving forward. Now, after that, we ask ourselves, what is my ask? So this is the thing you're actually asking for. Looking back on the example I said earlier about addressing homelessness, if you were to go in front of the state assembly or a city council and say, I want you all to do something about homelessness, they're all going to say yes. However, if there are 10 members of the city council, each one of those members might have a different idea of what doing something about homelessness actually means. So it's really, really important when you're engaging and advocating for something to have your ask be really specific. Folks should, I hope folks have heard about SMART goals. A SMART goal is a really, really useful tool in terms of framing your ask, because it forces you to be, specific, measurable, time-bound, all of the things. So it's important that you hone your ask before you begin the process of asking folks the question. And then finally, who am I asking? When you are advocating for something, it's important to target the folks who actually have the power to make the decisions that will either help you along your way. So for example, if I wanted the city, or if I wanted more funding for hospitals in Alameda County, and I have a really specific ask, and we want, a budget increase for all public hospitals in Alameda County. And then I go in front of the school board and I lobby for that in front of the school board. I mean, sure, they might agree to everything, but they'll probably be a lot more confused because they do not have the ability to grant or ask, and they do not have any power over hospitals. So obviously this is a really extreme example, but knowing who the decision makers are is really important in creating a strategy. All right. Now, next, now that we kind of have our ask, we know what our intended impact is going to be, and we know who our decision makers are. Step 4 is mapping this all out so we can wrap our heads around the different dynamics in terms of where do the decision makers stand on this issue? Who is influencing them in this decision? Are there outside groups that are organized that are working on either one side of the argument or the other? So this looks really intimidating, but I'm going to take you all on a step-by-step on this power mapping tool. So I created, and these are just the steps. I'll be sharing this slide deck with folks from the Ohana Center for Excellence. So they'll probably be distributing this after this webinar. So going back to step 3, I thought about a scenario in which, publicly funded animal shelters do not have enough funding. And so they tend to have higher kill rates of shelter animals. And so in this example, our intended impact is to reduce kill rates at publicly funded animal shelters. And then our ask is to increase funding for the Department of Animal Control by $1 million per year, beginning in fiscal year 2024, to increase capacity at publicly funded shelters. So you can see we have a really specific ask of $1 million in funding. We want that funding specifically go to the Department of Animal Control for the purposes of them spending it on animal shelters. And it's time bound. We want them to do it by fiscal year 2024. And then we next identify our decision makers. So we've identified that the city council has the authority to add to the budget of the Department of Animal Control in this particular city. And there are 5 members of the council, and we need 3 votes in order for this proposal to pass. So this will kind of guide our strategy moving forward. Now, the first step is to just highlight what the problem is, because again, we want to remind ourselves what is the impact that we eventually want to make, and we want a reminder of that here. I do want to take a moment to kind of talk you through the axes of this graph. So along the horizontal or x-axis, you'll see a +3, +2, +1, 0. That will indicate where folks stand on the issue. So right in the middle, 0 is absolute neutral. They do not have an opinion one way or the other about this. They're absolutely neutral. On the far left, the +3, those are your diehard supporters. Those are the people who no matter what the opposition tells them, no matter what they read, no matter what they see, no matter who talks to them, they will definitely be a supporter regardless. And then on the opposite end, the -3, those are people who are absolutely opposed to your arguments. They will never change their minds, and essentially nothing you do or say will change their minds. All right. And then on the y-axis or vertical axis, that indicates the amount of influence that any particular person or entity or organization has. So closer to the bottom, you'll see like those folks we map out on the bottom of the y-axis. Those are folks who influence hundreds of people. And then as we move up, we'll move into the thousands, and it could go up to the millions, right? Because if you're doing an advocacy campaign at the national level, then we're talking about, potentially impacting 300 million people. So that's just what that means. All right. So now that we've kind of identified what the challenge is, and that's written in the little cloud, on the upper left and upper right corner, we're just identifying the 2 opposing sides. So one side, the green rectangle, that's for folks who support the animal shelter. And then on the right side in red is folks who oppose funding for the animal shelter. Now, once we have this map set up, we're going to populate it with our decision makers based on the research that we did in step 1. Oh, I'm sorry. Before that, though, my bad. Before that, though, these kinds of little explosions, they note, or they're reminders for us where the decisions are going to be made. And the reason we want to put this on the power map is because you don't want to gear up for a fight or for a debate, and then it turns out you missed the meeting where the debate was going to happen. So here we identified that there's a city council meeting. If we knew the date and the time, we would populate it there. And then there's also a decision point that's going to be happening at upcoming budget negotiations for the Department of Animal Control. So we want to make sure that we have a presence at both of those sessions, meetings, if possible. And we want to make sure that we're prepared in time for those events. Sorry about that. Okay, now that we have the map set up, let's go ahead and populate it with our decision makers. So based on the homework that we did, let's say for this example that this is kind of where the city council lies. So as you can see, council member 1, they're pretty close to diehard, right? They're probably our closest, they're definitely our closest ally, and they're probably the best person to actually introduce the proposal that we want to advocate for at the city council. And then after city council member 1, council member 2, the mayor, and council member 3, I would say council member 2 and the mayor are like relatively neutral, kind of leaning towards opposed. Council member 3 a little bit more so on the opposition side, And then council member 4 is on the kind of diehard opposition, diehard oppose this measure. So already this alone can kind of give us a little bit of insight into the dynamics of the council, right? So if we only need 3 votes, I would say the path of least resistance would be to count on council member 1's yes vote, and then to convince council member 2 and the mayor to also support, because they're the most likely folks to change their mind and join the support side. Does that mean that we don't spend any energy on council member 3? Not necessarily. We could definitely spend some energy on council member 3, but in terms of prioritizing time, prioritizing resources, and prioritizing outreach efforts, we do want to focus a bulk of that on council member 2 and the mayor. We'll kind of go over a little bit more of the tactics later, but I'm just highlighting kind of the initial kind of insights that we can gain just from mapping out where the council members are. All right. So after that, we will then map out organized opposition and organized support. What I mean by organized is that these are folks who have either formally or publicly joined the debate on either of these issues. And what does that look like? It could look like they're meeting actively with the members of the city council and letting them know what their position is. It could be something like making public comments about the issue at a previous meeting, taking out, releasing public statements, for example, on their social media or in a press release saying that we believe so-and-so, this is our position on this particular issue. So for this example, we have 2 organized groups on either side of the debate. On the support side, it seems pretty obvious. The Department of Animal Control is very much in support of this proposal, simply because it means more operating budget for them, more money for them to do their work. And then on the opposite side is the City Budget Office. As we can probably guess, the City Budget Office, their primary goal is to make sure that the city makes responsible fiscal decisions about what it spends city resources on. And so they're skeptical. They do not want this increase because they don't want any increased cost for the city. I want to take this moment to kind of zoom in on the opposition, because in advocacy, there are different kinds of opposition. The first one is ideological opposition, and that means folks who oppose your idea because of their strongly held beliefs, because of their principles, because of their values, because of things like religion, right? They oppose this because they believe it's wrong. Ideological opposition tends to be very difficult to overcome, mostly because a lot of times someone who holds ideological opposition to something, it's because of deeply held beliefs, or it's because it's part of their identity, right? So we see this oftentimes in our politics on hot button issues like abortion, LGBTQ rights, racism, things like that. And that's why a lot of times when we debate this issue, these kinds of issues, it results in deadlock, right? It results in kind of a stalemate between the two sides because the opposition is ideologically based. Now, the flip side of that is kind of practical or functional opposition. And that's likely what the case is for this example, with the City Budget Office not wanting to, being opposed to this, right? It's not that they're ideologically opposed to animal shelters. They're not ideologically opposed to reducing the kill rates at animal shelters. Theirs is basically, their argument is, we don't hate this idea, but we can't afford it. We don't think we should spend this much money on this specific issue. Practical opposition or functional opposition is a lot easier to work with because you can problem solve around it. So in this example, and again, this is just an initial insight based on how we're mapping right now. In this step, the city budget office's opposition is likely functional opposition. And so we might want to think about strategies to eliminate the opposition by addressing their concerns. So if the city budget's office is saying that, the city can't afford a $1 million budget increase, then we can brainstorm ways to raise that money. Is there federal funding that we can tap into? Is there state funding that we can tap into? Is there a grant that we can apply for? And so if we're able to say we want to advocate for $1 million in additional funding for animal shelters, and we found $1 million in order to do so, that's likely going to eliminate the opposition from the city budget office. So something to think about as you're kind of moving forward in this power map. All right. So once we have identified organized support and organized opposition, now it's time to map out unorganized support and unorganized opposition, right? And so just populating stuff here. So unorganized support and opposition are groups who would likely be stakeholders in an issue, but have not been educated, have not been activated. Maybe they don't even know that this debate is happening. And so that has the potential of growing your coalition or growing your opposition's coalition. So in this particular example, we've identified pet owners, local school groups, and shelter workers, folks who work in the animal shelter itself, as unorganized groups that could potentially be allies, right? So pet owners, many of them probably adopted their animals through an animal shelter, and they would likely be in support. School groups, student groups, things like that, will likely also have support, will also be supporters. And because this means additional funding for their work, shelter workers will almost definitely be also in support. And then in terms of unorganized opposition, commercial pet store owners have not weighed in on this issue. However, they're likely going to oppose because they want folks to buy their pets from commercial pet stores. So it's also good to kind of understand the unorganized opposition and plan for it, just in case they do want to become organized on it. And then over here on kind of the upper left, I also wrote at the SPCA or animal rights groups. Now, this is when you kind of take a look at this power map and identify of these unorganized groups, which ones are likely to have more influence on your decision makers. So when we're talking about the mayor, for example, is the mayor likely to be more influenced by a faceless national organization that'll just issue a tweet and then move on? Or are they going to pay more attention to, constituents, residents in their city who are pet owners, students in their schools who are members of animal rights school groups? These are the folks who actually vote to elect. These are the folks who actually voted to elect the mayor. And so the mayor has a vested interest in making sure that their constituents' needs are being taken care of. And if constituents are saying that this issue is really important to us, it will likely force the mayor to take a look at their position and maybe be influenced by that position. All right. So with that, now that we have our school, we have all of our groups kind of identified, now begins kind of the analysis of this, the tactical planning, right? So step 5, after we've done our power map, is to develop a tactical plan. Basically, what steps do we need to take to get our ask granted by the decision makers in our strategic goal setting? So components of this includes an analysis of individuals and decision makers, personal stance, ideology, political agenda, and influence from outside groups. Analysis of relationship, who is influencing each of these decision makers, and then an analysis of external factors, right? Elected officials are very, very aware of upcoming election cycles. So if folks are up for re-election, they need to have a lot of people liking them leading up to the election. And so that might be a really great opportunity for them, for you to advocate, because these folks, elected officials who are running for re-election, are very, very eager to look like they are supporting the needs of the community and addressing the concerns of the community. So aside from election cycles, we might want to take a look at larger kind of environmental factors, right? Economic conditions, if the city is, if we're in the middle of a recession and the city is kind of going through a budget crunch because of the recession, chances are they're not going to be very receptive to a funding request for animal shelters. Another kind of consideration, or the flip side of that, is that if we're kind of at a time where the economy is booming and there's just a lot of tax revenue being generated, city council or whoever might be really willing to kind of start new programs and fund new programs because of the higher revenue. Aside from that, political climate and public sentiment is important. And I think in recent history, legislation in support of the LGBTQ movement and LGBTQ people is a really great example of how a shift in public sentiment, a shift in the political climate can really make elected officials act relatively quickly. If folks remember in like around 2010, protections for LGBTQ folks were kind of being done really, progress was slow, right? It was in fits and starts, it was piecemeal. But then once public sentiment kind of shifted around that issue around 2010, then you see a lot of jurisdictions, like whether it be from the Supreme Court, all the way down to individual state legislatures and even the federal government, enacted a lot of protections in support of the LGBTQ community. So that is just an example of how advocates can kind of keep an eye out on the political climate and on public sentiment and kind of take advantage of it when the timing is right. All right. So now that we've kind of gone over this, what does the power map actually tell us, right? So first, the first thing we've learned from this power map is that there is a viable pathway to win, and there are multiple pathways to win. There are times where at the end of a power map, you might take a look at it and realize that, wow, we don't really have any pathways for a win. It looks like no matter how we engage with organized and unorganized influencing groups, it's likely not going to change the minds of the decision makers. And that's also really important information to know, right? Because as I said in step 0, the kind of goal is to not burn out and make sure your advocacy is sustainable. If there are no viable pathways to win, maybe now is not the right time for you to engage in this kind of advocacy. You might want to wait for better conditions. Like again, if we're in the middle of a recession, chances are new funding proposals will not be considered. And so maybe let's wait until the recession eases or there's been an improvement in economic conditions. Same thing with coalitions. Maybe the coalition you're trying to work with is just stretched really thin right now, but maybe they'll be willing to work with you, 6 months from now or a year from now. That might be a better strategy than to force the issue immediately, if it's only going to lead to a loss, right? And then aside from there being viable pathways to win, We've come to learn that organized groups are relatively even on either side of the debate. So it's not like there's a huge power imbalance on the debate. So that's also a good sign for us. It's pretty evenly matched. We also learned from our power map that there's a lot of unorganized groups that can be activated to influence decision makers. And then lastly, we have learned that our opposition, the organized opposition against our proposal, it's not ideological, it's practical. And so there's an opportunity there to eliminate the opposition, okay? So based on these general insights, here are some tactics that we can employ. So we could work with our council champion, that's council member 1, the one who is most on our side. We can work with them to find funding to offset the cost of the proposal. We're also going to focus our efforts on the mayor and on council member 2, because as we saw, they're the ones closest to our side of the debate, and they're likely going to be the ones who are easiest to convince, right? We already decided that because council member 1 is so much on our side, they're a diehard supporter, that we don't need to spend additional resources convincing that council member, right? But does that mean we don't talk to them at all? Absolutely not. That's also not a good that's not a good tactic. Since council member 1 is a diehard supporter, we could always ask that council member to discuss, to chat with one of their colleagues in the city council. So we saw council member 4, and you know what, let's just go to that slide. We saw council member 4 being very, very opposed to the idea. And so nothing that you or your coalition might argue will likely change their minds. However, we learned that council member 1 and council member 4 regularly play golf together. They're colleagues on the city council, they're coworkers, right? They see each other day in and day out, and personal relationships may have developed. Maybe, you know, their kids are friends. If that's the case, then maybe our coalition doesn't need to engage with them. Maybe we'll ask council member 1 to kind of reach out to council member 4 and discuss, you know, is there wiggle room? Can you leverage that personal relationship to kind of figure out what their opposition is to this, so we can kind of learn more and adjust our tactics accordingly, right? And then aside from that, we can reach out to the unorganized groups and get them organized. So we'll reach out to student groups and ask them to submit letters. We'll ask shelter workers and pet owners to provide testimony and public comment at the upcoming budget negotiations and at the upcoming city council meeting. And then we can explore other strategies to eliminate the opposition, right? So aside from finding funding, is there any other way, you know, can we work with the city council to reduce costs in other places so that, got it. Just so we can eliminate the opposition. All right. So with that, the 2 more steps, and I know we have about 12 minutes left. So once power mapping reveals the decision maker targets for focused advocacy and envision outcomes. Oh, I'm sorry. So once we kind of have our game plan, we have to think of contingency strategies. So usually you don't get 100% of what you want in an advocacy scenario, right? Because other people weigh in, the city council, the decision makers have their own kind of comment spin on it. So it's important to ask your coalition these questions before the decision is made, just so we know where the coalition stands on this issue. So how realistic is it for us to expect a complete win, meaning 100% of what we asked for gets granted? If that doesn't get granted and there's kind of like a compromise decision being made, what alternatives are we okay with, right? What are we willing to live with? Let's say the city council said no to a permanent increase by $1 million on the funding, but maybe they'll do $1 million for 2 years and then we'll reevaluate. Is that something that your coalition is okay with? What if they say that we won't give you $1 million, but we'll give you 500,000 in budget increase? Is that something that your coalition can live with? And then finally, what's the deal breaker, right? If the council says, we'll say no to the $1 million, but we'll give you all $10,000. Is that a deal breaker for you? Because, one potential outcome is that they will pass that $10,000 budget increase. It won't make an impact on the issue, on the challenge, on the problem you're trying to fix, but the city council can go ahead and claim credit for doing something on the issue, even though they didn't really make the impact that you were looking for. So that's really important for your coalition to decide, is that a deal breaker for you? All right. And then finally, I think there's a big misconception that getting that decision is kind of the end of the battle, and it's not. It's just the beginning of the process. So if you win, who is implementing this? Who is implementing, right? Who is actually in charge of spending the extra $1 million? Is their game plan aligned with your game plan in terms of spending this money? Will the community be, is there going to be community engagement when they implement this new funding? Are there components of our proposal that didn't get passed that we want to revisit? When will progress be reviewed? And then will this funding need to be renewed at some point? And is that something that we need to gear up for, in the near future? So that's what happens when you win. If you lose, hey, try again. There's nothing stopping you from introducing the same proposal 6 months from now, a year from now. Is there a different strategy that you can employ? If you're not able to get it through the city council, can you put it on a ballot measure, for example? If this city council is particularly unfriendly to your proposal, is there an upcoming re-election? Is there potential to replace a couple of city council members to make it more friendly to your cause? And then the last bullet point, and I do want to caution folks against this and use it as kind of a last resort, is political retribution. That's, going in front of the media and saying, council member so-and-so is anti-animal, they is anti-pets, and is really hurting the community because of it. In certain cases, this might be an option you might consider, but chances are these council members, you'll need to work with them over and over on a number of issues. And so you don't want to burn your bridges and prevent yourself from working with them on any future issues. All right. So in a nutshell, that is a step-by-step guide to community-based advocacy. And if you have any questions, I'd love to take them now. I think we have about 7 or 8 minutes, so I'll stop sharing. And Marie or me, I don't know if I'm able to see the Q&A. You could help me out. Thank you.
Hi, Vaughn. Thank you so much. It's wonderful to learn the power mapping, a useful tool for us. I don't see any questions on the Q&A yet. Maybe we can wait a few more minutes.
Sure.
Yeah. Thank you.
No problem. And I know I went through all this information relatively quickly, so I hope I didn't confuse too many folks. But again, I'll send the slide deck over to Nee and to Marie if folks are interested. Maybe we'll just give it 1 more minute. All right. Well, maybe there are no questions. No worries. I know it's a lot to wrap your head around, so sometimes we need time to digest. Oh,
Oh, we do have a question here. So from your experience, how does participating with advocacy empower AANHPI individuals in terms of mental health?
how does participating in advocacy empower in terms of mental health? Well, I mean, I see it kind of empowering AANHPI communities in a couple ways. Number one, it allows communities to essentially advocate for themselves. I think a lot of times there's a preconception that it is only the responsibility of elected officials and policymakers to make the changes that we need to see in our communities in order to support these communities. But when you're engaging in advocacy, you are part of that process now, right? You get to tell elected officials, policymakers exactly what your community needs and exactly how they can address it. So that's on one level is kind of direct involvement in that policymaking process. I also think that there's something to say about the feeling of empowerment that you get once you know that you're able to engage with power. You're able to speak truth to power, engage with power. And so I see that as another way that it builds power and empowers communities in the AANHPI community. I hope that answers your question.
Thank you. Well, there are no other questions. Let's just follow up with that question. So what was your, is there any direct experience you involved with the NHPI population in terms of mental health or behavioral health services within AACI or from your previous experiences?
Yeah, so yes. So at AACI, I think for the Asian American and Asian American, Native Hawaiian, Pacific Islander community, data disaggregation has been a really important cause, right? Because as we know, this community is not a monolith. Individual ethnic groups have their own individual needs, particularly when it comes to health. And we were part of the coalition that advocated for Santa Clara County to publish an AAPI health assessment for the county, which really breaks down the healthcare needs of individual populations throughout the county. And so that got published in 2017, I'm really happy to say. And from there, we were able to custom tailor interventions specifically for each cohort. So right now, we have deployed, based on the data we learned from the health assessment, we have advocated in front of our County Board of Supervisors to provide funding for community health workers to go out into the community, targeting specific populations, and then creating health education and healthcare resources specifically to address that population's needs. So I'm Filipino, and so we have one group of community health workers targeting the Filipino community. And right now, their kind of biggest the biggest disparities that they're facing in health is, depression, diabetes, hypertension. And so we're able to kind of address those really specifically through our advocacy. And we're doing that with a total, I believe, 7 AANHPI cohorts right now. And we're hoping to continue expanding that over the years.
Yeah, that's amazing. Great to hear that. Thank you, Vaughn. And I'm also glad to hear that the data can also play a very important role in advocacy, right? So provide evidence base for policy changes.
Absolutely. And it's a really, really important advocacy tool, right? Because maybe the decision makers you're working with won't believe what you're saying until you back it up with hard data. And so that's another tool that you can employ when you're advocating for any number of issues.
Awesome. Thank you. Thank you, Vaughn. I think it's about time. And thank you for participating in today's event. Please don't forget to answer the post-event survey. And Marie already posted in a chat. Please take a few minutes to fill it out. We appreciate your feedback. And thank you again, everybody, for joining us. And thank you, Vaughn, for the excellent presentation. Thank you, everybody.
Thank you for having me. Have a great day, everyone.
Thank you. Bye.
Thanks.